Okay, so today we're going to review the Ht70 ventilator and patient setup with the ventilator for a patient with an endotracheal tube. We will not be discussing anything today about a patient with BiPAP. That's for a different setup. This patient here that we're going to be doing is just for a SIMV volume control mode. And then some troubleshooting things that we can go through to maintain fluency. So to review a few things with the ventilator, just to take a look, remember that we have the power cord. The power cord should stay plugged in as often as possible. Remember that when you do put the vent away, whether you've been practicing with it or whether you just got done transporting a patient, to make sure that you do plug it in to maintain battery charge. If you do not have a good battery charge, there is a good chance that this ventilator will not make it down to the truck from even an ICU unit unless it's maintained a good charge. So please don't challenge it, make sure that we keep it plugged in. On the back of the unit here, you'll see where the plug-in goes. When you discharge the plug to take it out, it's just simply a pinch. When you put it back in, it's the same thing, and it will feed back into the unit. Behind the unit too is the battery pack itself. The battery pack will stay charged. We'll get about 10 hours of battery life with a fully functioning ventilator with most of the things running on the ventilator. But again, we want to keep it plugged in as often as possible. So the machine is on now. It's gone through its basic internal setup and it's ready for our interface with the unit. Just as a side note, don't forget that we do have your high pressure line that you'll need to connect with the dial flow for the FiO2 based upon your patient's needs. The high port connects to the tank. Remember that make sure that you have a tank, especially if you're going to have any travel time whatsoever, to have a decently full tank to transfer the patient, especially if they're in a high FiO2 setting, because it will suck through oxygen relatively quickly. The other thing is to make sure that you always have your test lung with you. This is to be utilized with every single patient as we go through, and then obviously make sure that you have your patient circuit with you as well. Now we're going to focus a little bit more on the front end of the unit. On the top here you'll have your handle, and don't forget within your handle you'll also have the light interface for the alarms, one in red and then one in yellow. Yellow you can think of as a caution, and red obviously you can think of something as you need to address immediately. On the bottom of the unit here you have your plug-in piece for the actual ventilator circuit. On the top portion here on the other side you have your Prox Airline, which is a larger diameter plastic hose that's associated with the circuit. And then you have your exhalation valve circuit connector here that is a smaller diameter hose. Again, I'm sure if you push hard enough you'll get either one to fit on there, but try and make sure that you obviously pay attention so that's connected correctly. Over here you have your flow sensor. Again, we do not utilize flow sensors here. It's not advantageous for us and is particularly probably a little bit more inhibitive during a transport setting than anything else, because it is much more sensitive for the patient. But in a traveling mode, simple things like movement and cardiac oscillations can trigger the vent in the wrong position to deliver ventilations when maybe it's not needed. Here on top of the unit you also have your alarm silence button here. Let me zoom in just a little bit for you. Good. And then over here you have your manual inflation button. On the manual inflation button, it's simply similar to, or exactly like a inspiratory hold. The inspiratory hold is not something that we're going to routinely use to any degree, and probably most of you will not ever utilize it unless you're going to, for whatever reason, obtain plateau pressures and things like that. Down here is your screen brightness. You can change that in 3 different settings, and then it goes to almost an off position. Again, if it's not needed, just dim your brightness just like you would with your cell phone. It does, especially if you're on battery power, just preserve a little bit more of the time cycle on the battery. You have your up and down arrow cursors over here. You have your accept button. Again, with the accept button, as you'll learn as we go through here, everything you do and everything that you change, make sure that you utilize the accept button so that it does maintain the change. In right circumstances, for instance, if you changed your respiratory rate and went from 16 to 12 and did not hit the accept button, within about 5 to 10 seconds the machine is going to default back to the ventilatory rate of 16, even though you didn't want it to. Unless you hit accept, it will not lock that into place. You have your cancel button here as well, so if you're doing something, alarm settings or whatever, and you need to cancel it for whatever reason, you just hit the cancel button and it'll back out of it. Now we're going to focus in here on the screen itself. When the monitor first comes on and it goes through its own internal checks prior to our circuit check, the screen that comes up is going to be all the ventilator settings based upon the last patient that it was used on. We obviously don't want to keep these settings for the current patient, so one of the things we talk about is getting your patient settings in here as early as possible. The first thing, however, we want to do is do our circuit check. That is important for every single patient. That ensures that the machine is set up and that the circuit is good. Everything is set up for this patient as we go through, and that the machine goes through its internal checks to make sure there's no problems. So in order to do the circuit check, as we zoom out here, I'm going to show you with the circuit. The first thing that you do is you're going to take your circuit and you're going to plug the circuit ends in, just like I told you earlier, ends inside. So your circuit goes into here. The larger diameter line, or the prox air line, goes on top, and you're just going to push it in until it gets past the hub. The next one is going to be your exhalation valve. You're just going to connect it again just till it gets past a hub or two if you're really strong, but if you really want to pull it off hard when you're done. But make sure that it's just connected. On the other end here, you're just going to have your circuit piece here, and you're going to just follow the prompts as you go through your circuit check. And going through our circuit check here, let me zoom in just so you can see it as it goes through. As I start the circuit check, I'm going to, up here you have 3 buttons: start ventilation, circuit check, and activate preset. Circuit check is what we're interested in. We're going to hit circuit check. It's going to tell us to include the patient end of the circuit with our finger. So we're going to put your thumb over the end of it here and press accept. Once I hit accept, it's going to push air through against my thumb. Make sure that it is completely occluded, otherwise it will fail the test. Once you're done, it will say open the patient circuit. So you're going to take your thumb off the circuit, press accept to continue, and now it's going to go through its piston check. It's going to run through the pistons and blow air through the circuit to check its internal parameters and the max flow rates and things like that. Okay, so as you can see here, the circuit check is passed. It tells us to then press accept. When we press accept, it's going to go back to the screen that we had. Again, remember the settings that are on here are from the patient that was on this ventilator last. So what we're going to do then is look at what our settings are. On the side here on the top, you have the alarms screen button that you'll push if you want to go to your alarm settings. Underneath that, you're going to have your main screen. Once you look at your main screen here, which is really where we're at right now, then you have your more screen. We'll talk about that a little bit more in a minute. Below here, the first thing we're going to check is our mode. The mode of ventilation is how the patient and the ventilator interact. Right now it's set as SIMV, which is what we want. SIMV stands for Synchronized Intermittent Mandatory Ventilation. This is the premier setting that we're going to utilize in our arena for transfer of the patients, because it provides the easiest user interface, and typically for the average patient it requires very little effort out of them, but if they do have effort, it's much more comfortable for them to work with. Volume control is where we're going to live as well. Volume control says that for every time the ventilator is triggered, it's going to use a volume controlled manner to deliver the breath to the patient. If it was set on pressure control, it would be pressure regulated. So if we set it for 30 centimeters of water, when it hits 30 centimeters of water, the machine will stop flowing gas air into this circuit. For us, we're going to use volume control. Again, it's easiest for compliance. Do not forget, in the machine pack that is carried with, we do have the ventilator female and male volume charts that you're going to need to utilize and become familiar with. The average patient is, from literature, supports 6 to 10 milliliters of air per single breath. The range that we really want to use is going to be 6 to 8 mils per kilogram. And that's about the typical patients. Your lower end is going to be for your ARDS patients, and your higher end patients are going to be for those who need special support in that area. So right now we're looking at SIMV mode, volume control, that's where we want to be. So for this patient, and again for this patient in particular, I'm just going to use some basic settings. So in order to change the setting, we touch the screen. It will change the green to a darker green. We're going to go up or down from there. When I do change the tidal volume, don't forget your flow is going to change. That is normal. That's adjusted based upon the tidal volume that we're placing in here. And I'm just going to set it for 340 cc's of air. Remember, when we're done, we hit accept. It will default back to that natural green that was with the rest of the pieces. And so that's where we want it to be. If you do not hit accept, that will default back to where it was before, which I believe was 290 cc's of air. The next thing we're going to set is our respiratory rate. For this patient, we're just going to set a respiratory rate of 10, just so as I'm talking here, it's not so loud and interrupting as we go through. Again, it's dark green as I change it. When I'm done, I want to hit accept. When I hit accept, that will default back to that green. Your flow is, I want you to ignore that that's even there. What we change is going to adjust to flow as needed, and it's not something that we really need to mess with. Your I time is inspiratory time, so that's the amount of time that this machine is going to deliver the full 340 cc's of air. Right now it's set at I time of 1, so the I time is over 1 second. The patient's going to receive 340 cc's of air. The pressure support is something that's very important. Pressure support is only active when the patient triggers the ventilator, and this patient is going to receive a pressure support of 10 centimeters of water pressure throughout the circuit to allow the patient's lungs to expand and help them to keep the exercise in the lungs. Now, most of our patients are going to have, because we're moving them, because of changes, and because of issues potentially with sedation and things, are going to be breathing and may not be breathing efficiently. So pressure support's great for the patients that are breathing on their own, but in our arena for a critical patient, most of the time sedation is key, and pressure support, again, is only going to be active when the patient triggers the breath. So if your patient's adequately sedated and paralyzed, pressure support, while we need to have the setting there, is not going to be active. Your PEEP, the average physiological PEEP for the normal adult, is between 3 and 5 centimeters of water, and for the average patient on our ventilator, we're going to have and maintain around 5. Your pressure trigger, even though it shows here 2.0, is actually negative 2.0. And basically what it says is when the patient is able to draw 2 centimeters of water pressure against this circuit, so they're sucking 2 centimeters of water pressure against this circuit, the valve will open and the patient will be allowed to take their own breath. And that is what allows the SIMV to be so much more interactively comfortable for the patient that is attempting to breathe on their own. At this point here, we have our settings in for this particular patient. We've verified it based upon whatever means, whether we talk to the physician or the ICU nurse or however, but we have verified this. Remember to keep respiratory people involved with our care and our transition of care because they are very good at what they do, and that will allow us to have a smoother transition down to the ambulance. At this point then, you would take and you would connect your oxygen cylinder and the dial flow, and then what we're going to do then is we're going to move from here straight to the more screen. On the more screen you have an O2 cylinder data and you have a calibrate O2 monitor. So what we're going to do is we're going to first touch the O2 cylinder data screen. It's going to show us the different sizes of tank. Right now it's set up for a size E. Cylinder pressure has not been entered. The units are in PSI, which we want to maintain, and our O2 cylinder monitor has been disabled. So the first thing we want to do is enable the O2 cylinder data. That's going to allow us to do it, so now it says enabled. The next thing we're going to do is we're going to add in our cylinder pressure. You're going to do this by your up and down arrow. Enter it in. I'm not going to enter any of it in now because I don't have a tank in here, and it's just going to yell at me if I put something in there. Once you're done with all that, again, you're going to hit accept. You're going to go back to the more screen, and then you're going to go to calibrate O2. And when you calibrate O2, you have two functional calibrations that you can do. You can do a 21% FiO2 calibration and 100% FiO2 calibration. Before you put the patient on, I recommend doing the calibration. You can do the O2 calibration at 21%. If you have the patient on and you're really worried about the amount of oxygen that you potentially may have in that cylinder and the amount of time that it is, you need to enter in the appropriate amount of oxygen in the tank on the last screen, And then on this screen, you're going to want to enter in the calibration at 21% or 100%. I tell everybody, if the patient, you've already got the tank connected, do it at 100%. You simply take your dial, move it to 100%, and then after you get that done, you're going to hit OK and accept, and that will allow you to go through it. If you do the 21% calibration, it's going to tell you to remove all your equipment on the side. So if you've taken the time to assemble it, do the 100%. If you have not assembled it on the side, then go ahead and just do the 21%. Once that's done, it will tell you accept, it's good, and then you're going to go back to the main screen. Once we've got our oxygen attempt done and everything is in there and all the calibrations are completed, now it's time to go through and verify what we have for our patient. So what we're going to do at this point is just do nothing more than take our lung, and we're going to connect it to the end of the patient circuit. I'll zoom out here just a little bit. I'm going to connect it to the end of my patient circuit. The parameters are set for the current patient. Now what I'm going to do is I'm going to just initiate the start ventilation. And when I start ventilation, now it's going to deliver the patient breaths at 340 cc's of air per breath, 10 breaths per minute. My oxygen or my flow is set by the machine based upon our volume that we put in, and it's at 20. It's going to deliver it over 1 second for our I time. Pressure support is 10 if the patient takes their own breath. Our PEEP right now is 5 and our pressure trigger is 2. Again, the pressure trigger and pressure support are not needed unless the patient attempts to interact with the ventilator with their own breath. So now that I'm getting this to go through here, the first thing that we need to do is we need to go through and we need to do our alarm sets. Once this has been ventilating for a minute or two and you've gone through and you've verified with your partner, which I always recommend all the settings that you've placed into there, because it is something similar or new to us, to some of you especially, that you just need to be more fluent with it and make sure that everything's on there is where you need for the patient. Once you get that done, it's been ventilating for a minute or two, you're going to hit the alarm screen. And when the alarm screens come up, what you're going to do now is you're going to adjust the alarms based upon the current settings. The reason we do this is the alarms that are currently set for the patient are from the last patient that was on this ventilator. We have not done anything to change these alarm parameters to the new settings. So once this is done, we need to adjust, the settings are done for the patient, we need to adjust our alarms. And in order to do so, you're going to go to the alarm screen. If for whatever reason on the mechanical lung you are getting a dark red anywhere within this screen, you must first clear that and change the parameter so it goes away and everything on the screen is pink, or alarm quick set won't work. So simply from here I'm going to hit my alarm quick set button. It's going to tell me to press accept to confirm that I want to do an alarm quick set. All alarms then will be set automatically based upon the current monitored parameters that are sitting here. This is good because once this is done, any alarms that I get are a patient ventilator interaction alarm, which is what I want to clear. And those are the alarms that I don't want to miss happening. So from this standpoint, once we're done with this, these alarms are going to be set based upon the parameters for the current patient. So again, alarm quick set, I'm going to hit accept, and it's going to go through and connect the alarms and set those parameters at whatever percentage that the machine deems is valuable for the patient.